On behalf of Group 3, welcome to the Behaviorism Presentation Among Adolescents by Jessica Avalos, Tabitha Bush, Denisha Jamerson, and Leanne Kovac. Within this presentation, we will cover several objectives. Objectives include defining behaviorism, identifying and defining practice principles, identifying practice settings, and covering strengths and limitations of behaviorism. Let's start by defining what behaviorism is. According to Langer and Leitz, behavioral theory discusses how human actions are impacted by precipitating factors prior to a behavior and the consequences following. It works to describe the learning process of how consequences impact future behavior. The theory implies that if people have positive results from their behavior, they are more likely to continue that behavior. If people do not reach intended outcome, this may discourage them from repeating the behavior. According to behaviorism, environment shapes behavior. Behaviorism has many key concepts and principles that guide its theory. A widely known key concept or principle is known as classical conditioning. Classical conditioning is behavior that can be explained by precipitating events prior to the behavior. This is the earliest form of behaviorism and was developed and tested by Pavlov in 1927. A great example of classical conditioning is when a dog salivates when smelling food. The dog hasn't seen the food, but the smell initiates the behavior. Another principle of behaviorism is operant conditioning. Operant conditioning refers to behavior that is not only determined by initial reactions to stimuli, but the consequence that follows determines if the behavior will be increased or decreased. This theory was developed by Skinner in 1953. A great example of operant conditioning is positive reinforcement. What goes hand in hand next is reinforcers. Reinforcers are consequences following a behavior that increase the likelihood the behavior will occur again. These could be both negative and positive reinforcements. Punishers are consequences that decrease a particular behavior. These consequences are negative. And lastly, imitation. Imitation, simply put, is behavior that is learned by watching someone else. Because of its many guiding principles and concepts, behaviorism can be used in a wide variety of practice settings. The behaviorism theory is a theory that is very diverse, as it is commonly used in many different practice settings and can be used within different cultures and populations. The behaviorism theory has had a huge impact on clients, ranging from childhood to adulthood. Practical settings include, but are not limited to, clinical settings, special needs classrooms, private practice, hospital settings, rehabilitation facilities, and group homes. Like any other theory, behaviorism has its strengths and also its limitations. One of its many strengths are its evidence-based research. Social work interventions associated with behavioral theory, such as CBT, have been widely used in practice in diverse settings with clients due to the fact that its efficacy has been well supported through extensively evidence-based research. Examples of the populations that behaviorism interventions have been successful in are children and adolescents, young and adult and middle-aged adults, older adults often dealing with a wide variety of behavioral needs such as anger management, depression, and other psychiatric disorders. One of the great limitations of behaviorism is its focus on individual. Due to this focus on the individual, behaviorism does not address macro-system influences, and therefore it is of little help to clinicians working at the macro level. Another limitation of the behavioral theory is that methodologies based on behaviorism have traditionally emphasized the social worker as the expert. This conflicts with the social work principles of client autonomy. This limitation can be overcome, however, if the social worker makes an effort to integrate other techniques that allow for the client's voice and choice to be heard. In this slide, we will continue the strengths and limitations of the behaviorism theory. Other strengths include diverse intervention and the foundation of success. Behaviorism is widely used by clinicians due to the fact that the properties of the intervention can be used with a wide range of clientele. Not only that, behaviorism has built a strong foundation of success. Behaviorism has laid the fundamental foundation for many therapeutic interventions to be successful in empowering clients. For example, empowerment theory. Clients become empowered to gain the master skills over their lives. Client self-esteem increases through their own actions, and in turn, their actions then bring about behavioral change. Other limitations of the theory include its clinical modalities that are based on behaviorism theory. For example, if a clinician hypothesizes a certain stimulus elicits a certain response and the hypothesis is wrong, then this will usually lead to ineffective treatment. So, for the treatment to be effective, the clinician must examine the stimulus-response connection in great detail to make sure they have the correct chain of events. Another example of a behavior methodology that has limitation is the token ecosystem. While token economies are very successful when implemented correctly, they are much more difficult to establish than they appear. Even when token economies are implemented correctly, the client responds well. The staff must closely monitor the gradual phasing out of the economy. If fading of the economy does not happen correctly, then the client may not be able to generalize the new behaviors outside of the setting to which they were learned. In summary, we went over how behaviorism explains different behaviors. We identified and defined practice principles and different practice settings. We also cover the strengths and limitations of behaviorism. Behaviorism is specifically and especially great for use among adolescents since it can explain adolescents' behavior. It explains how they learn behavior and their environment that shapes the behavior.